Hello everyone, my name is Mike Brooks. I am the Vice Chairman of the Sullivan County Legislature. Thank you once again for joining us on this Town Hall Monday, April 13th. On behalf of the Sullivan County Legislature, we welcome Josh Potosek, our County Manager. We have Nancy McGraw, our Director of Public Health. And joining us today is Sims Foster. He's the founder of Foster Supply and Hospitality and also of the organization Single Bite. And he's a chairperson of the Sullivan County Visitors Association. So on behalf of our chairman, Rob Doherty, and the rest of the members of the Sullivan County Legislature, we're going to start today with Sims. He's going to share his thoughts and some of the things that he and his organizations have been doing during this pandemic. Sims, welcome.
Thanks, Mike, for having me, and hope the four of us in the room and on television are well, and I hope everyone that's looking at Facebook Live is well right now. It's a pretty big open question about my thoughts on the situation, and we all have thoughts. Specifically to tourism in the county. Firstly, I'm really proud of the tourism industry in this county on a daily basis, but also during this crisis, hotels are listed as an essential business and technically can stay open, but almost to a room in the county, everyone did the right thing. I know that we closed our rooms now as a month ago today, and so did almost everybody else in the county, recognizing that we needed to stop what is in our blood, which is bringing people here. 1 in 5 jobs in this county is directly tourism related. $35 million in sales tax contributed through tourism, and a huge number of total impact that we shut down a month ago. But we did it for the health of everyone, and someday soon, with some right balance, I don't believe it's going to be hey, let's start welcoming everybody back, but in some logical pattern, we're going to have to fire up the economic machine of the county to get sales tax back into the coffers. We're going to need organizations like the Partnership and like the Sullivan County Visitors Association who are there to smartly welcome people back to the county in an appropriate and safe way. It's not today, it's not tomorrow, it's probably not next week. None of us know exactly when it will be, but we will all be patient, as we have to be, and we'll be ready to start bringing our industry back when the time comes. I'll also say that as a founder with my wife of a not-for-profit called Single Bite, which normally educates kids with the school districts about real food versus processed food, we pivoted, popular word, fluidity and pivoting lately, but we pivoted that not-for-profit. Clearly we couldn't go into the schools to do our normal programming, and we've taken 2 of our kitchens and retooled them as commissary kitchens. Almost 30% of our neighbors are food insecure on a regular basis, and that need has become acute. So we're doing almost 2,000 meals this week with our team. We're distributing through the school districts, through rolling feed for student who know how to get the food to the families. And so we're doing everything that we can in this time to use our resources to try to help our neighbors. And I'll make a plea. People ask how you can help. I've got the hands, and in a bizarre way, you can't ask volunteers to come and stand next to each other, right, in this crisis. But anybody that has any ability to give a donation, you can go to singlebite.org. We are taking all the money and spending it only on product. The product right now is costing around $8,000 to $10,000 a week, so it's significant. I'm proud to say we've raised almost $50,000 in the last 3 weeks through private donations, but we need some more. So I don't usually like to ask for money, but in this case, when people are hungry, we gotta do whatever we can. So that's my thoughts. So I'll turn it back to you, Dan.
Thank you, Sims. We all thank you for what you and your organizations are doing. It's just a great example of what people can do in our county and throughout our state and country when individuals rise to the occasion. And we thank you for what you're doing, truly do. We're going to start with our questions now. And The first 7 questions are actually going to go to Nancy. So we're going to take these one at a time. The first question, what are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy?
Good afternoon. First of all, I want to wish everybody hope they had a very nice Easter holiday weekend and a relaxing one. So as you can see from our dashboard, we're up to over 400 cases with 409 confirmed cases at this time. From Friday, but we didn't report every day over the weekend, so we are following our continued trend of an average of 17 to 20 or more additional cases each day. So that is a lot, and we continue to climb in terms of community transmission is happening, and that's why we want to just remind you that social distancing is so important. And we want to thank everyone for really, as difficult as it was over the weekend to not visiting family members and isolating at home. So in addition to the 409 cases, the good news is that there's 245 of those who have since been released from isolation and quarantine and have recovered. And that's about 40% so far. We'll continue to see that increase as we go. Over 1,900 people from Sullivan County have been tested for COVID-19 since this testing started. Unfortunately, there was an additional death over the weekend, an additional person admitted to the hospital, making it currently 17 patients at Catskill Regional Medical Center who are hospitalized with COVID-19. And we're seeing about a 19.4% positivity rate. That means for all of the people who have been tested so far, about 19% are testing positive, and that is fairly high. And if we take a look at a comparison from the New York State COVID data tracker and compared to other counties, Sullivan County has significantly higher positivity rate. We don't really know why that is, but that rate is higher based on our smaller population size, and the number of people getting tested may in fact just be those who are much sicker when they get tested. So that's what we're seeing there.
Okay, Nancy, next question. What is the plan for antibody testing? Will all of it be done at the hospital or elsewhere?
So I know that there's been a lot of discussion on the state and national level about the importance of antibody testing in order for us to get back to work and back to normal as a society. And that is, the plans for antibody testing are being ramped up. Locally, I know that I spoke with the CEO of Catskill Regional Medical Center, Jonathan Schiller, who was also with us on the town hall discussion last week. I spoke with him today, and the hospital is working on developing the antibody testing. And when that becomes approved and available and ready, they will let the public know. I do not believe it will be done out of the hospital. It will probably be done out of the healthcare system through the Greater Hudson Valley Healthcare System, which is also part of CRMC is part of that system.
Okay, thank you, Nancy. Next question we have for you. Is rapid COVID-19 testing available yet? When do you expect it to be available?
So rapid testing is becoming available, and it is being done to a certain degree at some of our area healthcare providers' offices. It is not widely available yet on the scale that we need it to be, and the hospital is in the process of developing and getting manufacturer approval for rapid testing. The one very important thing that I want everybody to know about rapid testing is that rapid testing needs to be coordinated, and there's a lot of vendors who are selling rapid testing kits. It is very, very important in order to have quality control of the data and the testing results that any healthcare providers that are purchasing rapid test kits make sure that they are either FDA approved or they have some quality controls built in terms of the sensitivity of the results so that we don't get a lot of false negatives. That will present a lot of problems, and so we're having discussions with our healthcare providers about that.
Okay, our next question. For Nancy, what is being done for those who are diagnosed with a mental health issue who are not taking the necessary precautions at this very important time? This population may have the perception that this is not real, that it's the government trying to control them.
So there's a lot of vulnerable individuals in our communities, and mental health diagnosis makes it very difficult in some instances for individuals to cope with anxiety and sometimes to determine what is true, what is not true, what information they can rely on. So our community services through the county's mental health clinic is working very hard to educate their clients and residents. And I know that our mental health professionals across the county and our call center individuals are taking those kind of calls. I want to remind everyone that education and reassurance and really helping people with problem solving and what they can do to protect themselves will help to reduce anxiety, and sharing factual information. The state's Office of Mental Health has an emotional support line, which we've provided before. That number is on our website. It's the 1-888-863-9314, and we just encourage everybody to share that information and to support those community members who are having a very difficult time.
Thank you, Nancy. Next question. I'm told a local company with many employees has had positive cases. What is the county doing to deal with outbreaks in large businesses? And should the public be notified when this occurs?
One of the things that is traditional in how public health departments throughout the state and the nation conduct disease investigations and surveillance and control is to follow protocols and to follow a process. So when there are a positive case or multiple positive cases, let's say in a particular location or business or facility, public health notifies the individuals who are personally impacted by a positive result. So the individual who has a positive result, then there's an investigation, like an interview, a phone interview with that person to determine who they were in close proximity to, close contact with, based on the disease. So we're talking about COVID-19, and we use a case definition and we use protocols to identify who's most at risk in terms of, how long does the virus live, how is it transmitted? Through droplets. It can live on surfaces, up to 48 hours or more, and close contact, 6 feet or more. So individuals are interviewed by phone by our staff, whenever that's possible, to get as much information as possible, to also let any exposures, what we call exposures, of other individuals that they were in close contact with within the past preceding 14 days. So then those individuals are notified that they need to be quarantined and they need to monitor themselves for symptoms. So this is a lengthy process, and you can understand the volume of work that's involved when we have not only positive cases, but individuals who are exposed, and we do contact tracing. So we are almost at 900 cumulative so far to date individuals on a mandatory quarantine. Now, in terms of healthcare workers and essential workers, we follow the state health department and CDC guidance, which varies slightly depending on where a person works, whether they're a healthcare worker or an essential worker. We work with the employers on disinfection, on policies and procedures, and we walk them through the whole process. It is really a private business's individual decision to release information if they have had any cases in their place of work, and we work with them to provide some guidance in order to protect the confidentiality of their employees.
Thank you, Nancy. Next question for Nancy. How many surfaces can you clean with a single wipe and still eliminate COVID-19?
So I don't know that the research has been done on this question in terms of a single wipe. I suppose if the Clorox wipe starts to dry out, you need to use a new one. But some general guidance from the CDC and OSHA on disinfection and cleaning for COVID-19 is available on their websites, and we have that information on ours as well. Cleaning is a bit different than disinfection. Cleaning will just clean the dirt on surfaces. It won't necessarily take care of any viruses. So disinfection recommendations include, an alcohol-based sanitizer, soap and water, and Clorox-based cleaning guidance that are EPA approved. So daily is recommended, or more frequently if it's a high-risk facility like a nursing home or a hospital. And I know that all of our facilities have been diligently following these guidelines.
Okay, Nancy, next question for you. Can frozen foods go right into the freezer, or do the packages have to be cleaned first to ensure the virus does not survive? And maybe before you answer that question about the frozen foods, I'm just curious. You talked about alcohol-based cleaners or disinfectants. Any thoughts on hydrogen peroxide?
That one we're going to have to get back to you, but you probably can find it on the CDC website.
Okay, thank you, Nancy. Now to that frozen food question, Nancy. Can frozen foods go right into the freezer, or do the packages have to be cleaned or disinfected first to ensure the virus does not survive?
So again, we would refer people to the State Health Department website and the CDC website. We also have that information on our county website. But what we were able to find in terms of frozen foods and really is, let's go back to how this virus is spread and risk levels. So the highest risk level is that the virus is spread by droplets from person to person. So someone being close to you, sneezing, breathing, transmitting, droplets, that is the highest risk. It's much lower risk for anything to be transmitted through food or packages. And we've got this question before in terms of the mail. But disinfection commonly used for surfaces that are frequently touched really seems to take care of the virus and do a really good job. In terms of frozen foods, I want to be clear that there's been no research to show that virus can be transmitted through preparation of food, through packaging of food. There are really, really important safeguards that go into the preparation and packaging of food, and you can consider this one of the safest things that we have right now, especially given the care with which our restaurants and our businesses are taking to make sure that they can stay in business and safely feed the community and feed our children through the schools and deliver meals to people who are homebound, through the Office for the Aging. So it's very, very safe. In terms of having to clean the packages, I don't think it's really necessary before you put them in the freezer. If you want to open the carton container and then make sure you wash your hands before you remove the frozen containers to put them in your freezer, you can certainly do that. But I think on the scale of risk, this one's pretty low.
Okay, next question goes to Josh. Were there any issues over the holiday weekend with people gathering in large groups? And if so, what did the county do about it?
Good afternoon, everyone. I hope everyone had a safe and healthy holiday weekend. Fortunately, we were aware of one incident on some public land that a local law enforcement responded to and disbanded cordially with the people that were gathering. So we're aware of one issue. I think that really speaks to the commitment of the residents and visitors that they are sheltering in place. And it's important as we get toward the apex and the plateau of this pandemic that we kind of stay the course, as painful as emotionally and economically as that is. We need to stay the course until we kind of get on the other side of this apex.
Thank you, Josh. Next question I'm going to answer. The question reads, how can I participate in this Thursday's county legislature meetings? We have a full board meeting at 11 o'clock.
10. Is it 11?
I think it's
11, sorry.
11 o'clock this Thursday. And there is a link on the county legislature page that you could click on and actually watch it live stream. If you have a question that you would like us to consider, you can email our clerk at Anne Marie, that's Anne with an E, so annemarie.martin@co.sullivan.newyork.us. I'll repeat that one more time. It's Anne Marie with an E, .martin@co.sullivan.ny.us. Next question is for Josh. Do I have to file my income taxes by Wednesday, April 15th?
Short answer, no. Both the federal and state governments have moved the tax filing deadline to Wednesday, July 15th. There are no late payment penalties or interest due if paid by that time. Additionally, the federal government has authorized and allowed individuals and businesses and corporations that have to make required estimated quarterly payments. They can now file them by July 15th as well. But one recommendation, if you historically do get a refund or think you may get a refund, the federal government and state governments are both processing refunds at this time, so don't wait till July 15th if you typically get refunds or think you will get a refund. There's the typical delays, but they will and are processing refunds at both the federal and state level.
Thank you, Josh. Excellent. For you again. Do you think school will remain closed for the rest of the year?
Obviously, a decision that's being made at the state level through New York State and the governor. Obviously, schools have a profound effect on the economy, but they serve as daycare for people getting to work. So it has monumental impacts on just the functioning of society in general. So it's no light thing to have to close schools for any period of time. And I think you've just kind of seen some of the exchanges we've seen with Mayor de Blasio and the governor recently about the New York City schools closing. The governor has reiterated that's his decision to make, and we'll see how that plays out. Unofficially and having no bearing on what will ultimately happen, I personally think schools will probably remain closed through the balance of the school year, seeing them reopen hopefully in September.
Thank you. And the last question we have today is again for Josh. Move Sullivan is now requiring masks to board its buses. Will masks be provided to passengers? If not, how do we find one?
So that's correct. We're, as of the weekend, requiring, or as of today, requiring all passengers on Move Sullivan to wear masks. Unfortunately, we don't have enough masks even for all of our own employees that are dealing with public now. So there's actually going to be a press release going out, and what our Community Emergency Assistance Center has been working on is what they're calling a mask brigade. Looking for anyone that can sew, knit, make masks to kind of volunteer their time and resources to kind of donate and make masks for are those in need. And obviously those will probably go first to kind of county staff that are in the front lines dealing with public, but then the goal is to also have them available for people such as riding our transportation system. If you are one of those people that think they can provide and donate masks, please call 807-0925 and explain what you can offer and in what quantity. It'd be greatly appreciated.
Okay, now our Director of Communications, Danielle Hust, is going to just give him a second. He's going to bring up a little PSA from our Surgeon General.
For those of you who don't have a mask handy but want to make one, the CDC has a very simple way of doing it.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top, and then 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle, and you have yourself cloth face covering. It's that easy.
Okay, can't get any easier than that. On behalf of the Sullivan County Legislature, I'd like to thank Nancy McGraw once again.
N95
Whoops.
respirators are
Josh,
designed to
close it
protect
once
you
again.
from breathing in very small particles
Hang on a
that
minute.
make
There we go.
And I'd also like to thank once again to goes to Sims Foster for joining us today and sharing his thoughts and what he has been doing with the great work with his foundation, his companies. Thank you very much. It just goes to show that through tough times, so many people step forward and do wonderful things. We hope that everybody had a wonderful Easter, happy Passover, and that even though it was a little different this year, we'll get by. It's just a matter of time. In the coming weeks, maybe months, we'll be talking about how to be safe and how to resume going to work and some sort of normalcy can return to our lives. Those conversations will be happening more frequently, not now, but in the not too distant future. But for now, have a good afternoon, be safe, bye for now.